Hello, and welcome to the Encore Research Group podcast, where we encourage community research and education with weekly podcasts. I'm your host, Benton Loeyball, and this week we're talking about diabetes. Diabetes, from your head to your toes. When the topic of diabetes comes up, most people understand that it is a condition that impacts blood sugar. However, they may not realize the complexities of the disease beyond monitoring blood sugar levels and medication adjustments. On the other hand, people who have been diagnosed with diabetes know that it is a very complex condition. Uncontrolled, high blood sugar affects everything from your head to your toes. With diabetes, the body is unable to use the sugar found in the blood for energy, resulting in elevated blood sugar. Excess sugar in the blood causes damage to the blood vessels and nerves. There's a common saying that diabetes will not kill you, but its complications will. Complications from diabetes occur primarily due to damage to small or large blood vessels. Small blood vessel or microvascular damage affects organs and systems where these small vessels are critical to function, such as with delicate sensory or filtering systems. Large blood vessel or macrovascular damage affects large systems which use a lot of blood. Microvascular complications include damage to the eye, with diabetic retinopathy, diabetic macular edema, and these can lead to blindness. Damage to the kidney, with diabetic nephropathy and chronic kidney disease. And damage to the nerves, with diabetic neuropathy and peripheral neuropathy, which can lead to sexual dysfunction, gastroparesis, and foot ulcers. Macrovascular complications include damage to the heart, with coronary artery disease and myocardial infarction, also called a heart attack. Damage to the brain, with stroke or cerebrovascular accidents, and damage to the limbs, with peripheral artery disease and lower extremity amputations. Other related conditions include mental changes, such as Alzheimer's disease and depression. If you have been diagnosed with diabetes, it is extremely important to manage and control your blood sugar levels. This will help minimize and prevent complications that arise from uncontrolled diabetes. Although there is not a cure for diabetes, there are many effective avenues available to help manage and prevent the resulting complications. Therapies include glucose monitoring, meal planning and food choices, regular exercise, and prescribed medications. Therapies continue to improve with new research. Researchers are working tirelessly to find new therapies for diabetes and its complications. If you would like to experience science firsthand and help move medicine forward, consider volunteering for a clinical trial. Thanks for joining us on this week's episode. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at encoredocs.com. That's ENCOREDOCS.com. Encore Research Group has been involved in clinical research for over 25 years. We have 7 clinical research sites across Florida, including 2 Phase 1 units. If you're in Florida, join us at sites in Northeast Florida and on the Nature Coast. If you're outside of Florida or South Georgia and are interested in joining a clinical trial, head over to clinicaltrials.gov. For more great content, including discussions by physicians and clinical research experts, check out the MedEvidence podcast. My name is Benton. Thank you for joining, and we'll see you next week.